small animals. Life is not. ADETOLA is happily married.
Structured in this manner. I will start with a preamble and explanation of the concept of what we are discussing today. Thereafter, I will give my contribution to knowledge and then my contributions to human development. We will round up with conclusions and recommendations from this lecture and finally the acknowledgement. Preambles. The veterinary oath is a pledge made by veterinarians at the point of induction into the veterinary profession. It contains important components of professionalism in the daily routine practice of veterinary medicine. The oath for Nigerian veterinarians states thus: being admitted to the veterinary profession, I, ADETOLA AJADI, solemnly declared and promised to use my scientific knowledge and professional skills for the benefit of the society through the protection of animal health, the relief of animal suffering, the conservation of livestock resources, the promotion of animal production and of public health, and the advancement of veterinary knowledge. I will practice my profession conscientiously and with dignity in keeping with veterinary ethics. I accept as a lifelong obligation the continual development of my professional knowledge and competence. The Vice Chancellor, sir, I took this oath on 30th June 1998 at the Trenchard Hall, University of Ibadan. And this has been a major driving force for my engagement in veterinary practice. The veterinary oath has 5 basic themes, namely the protection of animal health, the relief of animal suffering, the conservation of livestock resources, the promotion of animal production, and the promotion of public health. The Vice Chancellor, the first inaugural lecture from the College of Veterinary Medicine, titled Healthy Meat for World, was delivered by my mentor and a former Deputy Vice Chancellor of the university, Professor Murenike Atinuke Dikpeolu, on the 23rd of June 2010. And this was centered on the theme, Promotion for Public Health. The second inaugural lecture from the college, titled The Magnus Opus of Reproductive Anatomy, the African Giant Rat and the Giant of Africa, was presented by my brother and a former dean of the college, Professor Adebayo Konyum Akinloye, on the 6th of March 2024. And this lecture was centered on the theme, Promotion of Animal Production. Today's inaugural lecture, The Silent Voices, Recognizing and Relieving Pain in Animals for Better Welfare, is the third from the College of Veterinary Medicine and the first from our new Department of Veterinary Surgery and Seriogenology. And this lecture, we could focus on the theme, Relief of Animal Suffering. Explanation of concepts. The ability to experience pain is universally shared by all mammals, including man and animals. Physiological and behavioral observations show that animals do not only experience the sensory aspect of pain, but they also experience the unpleasantness, the averseness, and the negative emotions that are attached to pain. Animals have the capacity to feel both the positive and the negative aspect of pain. This is observed as animals seek pleasure and they avoid suffering. Thus, veterinary professionals have both ethical and medical duty to prevent, diagnose, and treat pain in animals. Stigall et al., 2021. Definition of animal sentience. Animal sentience is the capacity of an animal to experience both positive and negative emotions. Discussions on the abilities of animals to experience feelings and pain and pleasure and suffering have been on for several decades. Philosophers such as Plutarch, Hippocrates, and Pythagoras are all advocates for humane treatment of animals. Their reason simply was based on the understanding that animals can experience pain and suffering, even if they cannot communicate it, the silent voices. Jeremy Bentham wrote in 1789, the issue is not whether they can reason or they can talk, but whether they can suffer. Definition of pain. Pain is a complex, multi-dimensional experience involving sensory and emotional components. Pain in animal can be defined as an aversive sensory and emotional experience representing an awareness by the animal of a damage or a threat to the integrity of its tissue. Moloney and Kent, 1997. This implies that the inability to communicate pain does not remove the possibility of experiencing pain. Pain is a unique individual experience, making it difficult for others to appreciate how it feels. The Yoruba says, "Ẹni tó kàn ló mọ̀." Pain recognition. The process by which pain is perceived is complex, incompletely understood, and cannot be measured objectively. Accompanying the unpleasant experiences are measurable physiological responses that are mediated primarily by the autonomic nervous system. Behavioral expression of pain is species-specific and is influenced by several factors such as age, the breed of the animal, demeanor, the type and duration of the pain, the clinical condition, and the presence of additional stressors. Montero et al. 2022. The Vice Chancellor, sir, the video on our right is that of a 3-year-old pug that was presented to us following cervical spondylopathy, or what humans will call stiff neck, after acute traumatic injury to the neck. If you check the video, you notice that this animal was finding it difficult to raise the neck. It was panting or breathing heavily. And the video on the left, on the other hand, is showing this animal 24 hours after we have administered fentanyl, an opioid analgesic, and meloxicam, a non-steroidal anti-inflammatory drug. These two videos underscore the importance of early recognition and management of pain in animals. Pain assessment. Animals are non-verbal and cannot self-report the presence of pain. Thus, the burden of pain assumption, recognition, and assessment lies with the veterinary professional. Pain assessment should be a routine component of every physical examination of the patient. And a pain score should be the fourth vital sign after temperature, respiratory rate, and pulse rate. Behavioral signs of pain include both the loss of normal behavior of the animal and the development of new abnormal behavior. These behaviors may be subtle and can easily be overlooked both by the parent of the animal as well as the veterinary healthcare team. Epstein et al. 2015. Common behavioral signs of pain in animals include anxiety, depression, inappetence, reluctance to move, reclusiveness, and irritability manifesting as aggression. So sometimes when you see your animal a little bit aggressive, it may mean that this animal is in pain. Pain management. Owing to the complex nature of pain in individuals, there is no single method for pain management. Thus, veterinarians must individualize which method is adopted in order to provide optimal pain control. The platter approach provides individualized pain management for any patient and is devised not on static basis, but on continuous cycle of plan, treat, and evaluate based on the response of the patient to the treatment. General management of pain in trauma patients. Pain is best managed early and with a robust protocol in dogs and cats with traumatic injury. It is harder to treat pain once it is well established. The goal in the management of pain is to abolish it or to reduce it to the barest minimum. Preventive analgesia refers to the administration of analgesic before, during, and after each operation. Montero et al. 2022. The drugs that are frequently used for preventive analgesia include non-steroidal anti-inflammatory drugs like meloxicam, like piroxicam, local anesthetics, opioid analgesics, alpha-2 adrenoceptor agonist, and N-methyl-D-aspartate. Multimodal analgesia. Multimodal analgesia is the use of multiple analgesic drugs, regional analgesia, non-pharmacologic interventions to modulate the peripheral and the central nervous system loci in the pain pathway. Concurrent administration of drugs and treatments that act at different sites ensure that we have greater pain control. In addition, the pain control is not dependent on a single drug. Therefore, dependency on that single drug is avoided. Myths and misconceptions on pain in animals. Pain management can be complex and challenging in any setting. However, veterinarians and para-veterinarians have both medical and ethical responsibility to manage pain in animals. The major barrier to good pain management in animals are the myths and the misconceptions that we have over the years about the physiology of pain in animals, animal pain behavior, the availability of safe and effective analgesic drugs, and as well as the owner's psychology. AJADI 2023. Veterinarians and para-veterinarians, including everyone here, therefore have a very huge responsibility to correct this misconception for themselves. Contribution to knowledge. The Vice Chancellor, sir, as an academic veterinary surgeon, I've spent the last 25 years in teaching, research, and offering surgical consultation to the community. I've carried out over 2,000 surgeries in several species of animals, including dogs, cats, cattle, horses, pigs, sheep, goats, rabbits, several species of monkeys, lion, and several species of birds. I've carried out extensive research on different techniques of providing conducive environment during surgery. My research focus has been on the four main themes: management of acute pain in animals by developing anesthetic techniques for the control of perioperative pain in surgical patients, especially in a poor resource country like Nigeria. I've also worked on understanding the pathophysiology of chronic pain, especially in musculoskeletal diseases with special focus on osteoarthritis. I also worked on the application of diagnostic imaging techniques like radiography to understand the pathophysiology of musculoskeletal diseases in rapidly growing large breed dogs. And also I worked on the evaluation of animal welfare, especially transportation stress in cattle. The Vice Chancellor, sir, it is not all about animal. I also worked on the workplace welfare of veterinarians in Nigeria. I shall discuss some of my important scientific contributions in this area. Management of acute pain in animals. There is no ideal anesthetic or analgesic agent due to the differences in the efficacy and the side effects of different agents in different species. This is occasioned by the metabolism of each agent in a particular species. For example, paracetamol that we commonly use will cause fatal adverse effect if administered to cats. In the same vein, tramadol, which is said to be effective in cats, is not very effective in dogs. Thus, the practice of anesthesia and analgesia have to be tailored to the needs and the peculiarities of each animal species. With this understanding, sir, I worked on the number of anesthetic agents to determine their effectiveness for perioperative pain control in different species of animals. Our study on ketamine. Ketamine is a rapidly acting dissociative anesthetic agent and an N-methyl D-aspartate receptor agonist used for anesthesia and long duration of analgesia in many species, including humans, non-human primates, dogs, cats, ruminants, pig, laboratory animals, wildlife, and birds. AJADI et al. 2007A, 2008A and B, 2009A and B. Advantages of ketamine include minimal cardiovascular depression and potential stimulations of cardiovascular function through its sympathomimetic effect. Ketamine is perhaps the safest and the most widely used anesthetic agent in the whole world. However, its use can result in poor muscle relaxation, ophistotonus, myotonic contractions, and poor recovery. Ketamine anesthesia in pigs. There is no single anesthetic agent that has been found ideal in providing adequate anesthesia for surgery in pigs. Thus, two or more drugs are often combined for this purpose. Commonly used drug combinations include telazole ketamine, telazole xylazine, telazole ketamine xylazine, ketamine xylazine butorphanol, and ketamine medetomidine butorphanol. Most of these drug combinations are not available in a poor resource setting like Nigeria, while majority are not economically feasible for production animal surgery. In the light of this, AJADI et al. In 2008 evaluated the safety and the efficacy of ketamine xylazine midazolam combination in pigs, as well as the influence of increasing the dosage of ketamine on the anesthesia produced by ketamine xylazine combination. This study showed that ketamine xylazine midazolam combination provides sufficient analgesia for surgery in pigs. AJADI et al. 2008. Ketamine anesthesia in birds. Ketamine xylazine combinations have been evaluated in several species of birds and are associated with increased blood pressure, decreased heart rate, and hypoxemia. A ketamine midazolam combination assessed in malak dog was associated with moderate sedation, and it only produced analgesia at a very high but unsafe dosage. Therefore, AJADI et al. In 2009 evaluated the influence of midazolam on ketamine xylazine combination to determine if the addition of midazolam will improve the quality of this combination. It was observed from this study that ketamine xylazine combination in guinea fowl improved the quality of anesthesia, as well as not influencing the safety of the combination. AJADI et al. 2009b. And this combination was recommended for surgery in birds. The Vice Chancellor, sir, this publication has been cited over 40 times. Our studies on tramadol. Tramadol is a dual-action analgesic drug with both opioid and non-opioid activity that is widely used for control of acute and chronic pains in animals. Dominguez Oliva et al. 2021. It is a commonly prescribed opioid for dogs and cats in most countries of the world because of its low cost and less stringent regulatory restrictions when compared to other opioid anesthetics. Owing to the potential of tramadol to provide perioperative analgesia, AJADI et al. In 2009 evaluated the influence of premedication with tramadol on xylazine ketamine anesthesia in young pigs. It was observed that tramadol premedication at 5 milligrams per kg improved the quality of anesthesia induction and increased the duration of anti-nociception in ketamine xylazine tramadol anesthetized young pigs without increasing the duration of recumbency nor causing additional depression of the physiological parameters of the pigs. This was the first study that evaluated the use of tramadol in combination with ketamine and xylazine in pigs anywhere in the world. This article has been cited over 50 times and referenced in 2 textbooks. Evaluation of epidural tramadol in goats undergoing castration. Castration using rubber ring in lamb or kid is a common husbandry practice to improve the quality of meat. However, this practice has been associated with welfare concern relating to pain, owing to the potential perioperative analgesia of tramadol. AJADI et al. In 2012 evaluated the effect of a single epidural injection of tramadol on behavioral changes, anesthetic indices, and plasma concentration of cortisol in goats subjected to castration by high-tension rubber band. The result of this study showed that lignocaine injection produced a longer duration of anti-nociception with lower frequency of pain-related behaviors, while treatment with epidural tramadol injection allowed the goats to continue to graze once we applied the rubber ring. This study further proves the efficacy of tramadol through the epidural route in providing sufficient analgesia for castration in goats. Evaluation of gabapentin for pain control in dogs undergoing ovariohysterectomy. Gabapentin is a structural analog of gamma-aminobutyric acid formulated for the treatment of convulsion and neuropathic pain in humans. Almeida et al. 2023. Several clinical trials and meta-analysis show that the administration of gabapentin improves post-operative pain associated with abdominal hysterectomy and mastectomy in humans. This led to the growing interest in the use of gabapentin for control of perioperative pain in veterinary medicine. Although gabapentin has been used for pain control in dogs, there is insufficient evidence to support its analgesic efficacy. AJADI et al. In 2023-25, therefore, evaluated the efficacy and safety of gabapentin for perioperative pain control in dogs undergoing ovariohysterectomy. Ovariohysterectomy is a form of surgery that we use to neuter a female dog. We remove the ovary and the uterus. It was observed that premedication with oral gabapentin decreased postoperative pain scores in dogs treated with oral gabapentin. In addition, premedication with oral gabapentin did not alter the physiological parameters of the dog undergoing elective ovariohysterectomy, proving its safety. It was therefore recommended that oral gabapentin can be used as a component of a multimodal analgesic for surgical procedures in healthy dogs, especially in a poor resource setting where true opioid analgesics are not available, or in cases where non-steroidal anti-inflammatory drugs are contraindicated because of their adverse effect. Mr. Vice Chancellor, sir, our work on osteoarthritis. Osteoarthritis is a degenerative joint disease characterized by damage to the articular cartilage and changes in the subchondral bone. This disease is frequently accompanied by secondary synovitis. Although progressive destructions of the articular cartilage is the main feature of osteoarthritis, other joint structures are not spared. The global prevalence of osteoarthritis has been estimated to be 7.6% of the total world population in 2020. That is approximately 595 million people in all the world. 45% of women over the age of 65 have symptoms of osteoarthritis, while radiological evidence has been found in about 70% of females above the age of 65. Ding et al., 2024. Osteoarthritis is the major cause of mobility impairment, particularly among females. Pain is the most presenting sign of osteoarthritis. And these pain signals are generated by sensory nerve endings that are intrinsic to the subchondral bone. Unlike many other painful conditions that resolves, osteoarthritis do not resolve. And that is why the pain in osteoarthritis is maladaptive. Mr. Vice Chancellor, sir, as part of our effort to look for solution for osteoarthritis, especially in animal, we worked on the role of snail mucin as treatment for osteoarthritis. The land snail has been used in medicine since antiquity. Mucus from snail has been reported to slow down the inflammation of lungs. Also, the lecithin from the land snails has been used as prognostic indicator for some cancers, such as breast cancer, stomach cancer, and colon cancer. Dweck et al., 2001. Acaran sulfate, a mucin from Achatina fulica, has been demonstrated to act as an angiogenesis inhibitor and as an anti-tumor agent through its regulation of matrix metalloproteinase activity. Understanding the fact that matrix metalloproteinase is an enzyme that degenerates the basement membrane, we therefore looked at the role of mucin in the management of osteoarthritis. Mucin from jellyfish has been described to have potential disease-modifying effects on osteoarthritis in rabbit cartilage. AJADI et al., with the promise that mucin from snail can influence the progression of osteoarthritis, compared the potential osteoarthritic effect of snail mucin with that of glucosamine, a regular drug that is prescribed for people with osteoarthritis. The efficacy of the treatment of the efficacy of snail mucin was assessed by changes in interleukin-6 and matrix metalloproteinase 3, while the safety was assessed by determining the changes in the PAC cell volume, the leukocyte changes, as well as the adverse reaction that is associated with the administration of snail mucin. In this study, administration of administration of snail mucin, lowered the plasma concentration of interleukin-6 as well as matrix metalloproteinase 3. And the result is shown to be comparable between glucosamine and snail mucin. It was therefore concluded that both oral glucosamine and snail mucin injection can modify the progression of osteoarthritis. However, owing to the adverse reactions noted with intramuscular injections of snail mucin, further studies are required to determine the most appropriate route of its administration. Hip dysplasia, a major cause of osteoarthritis in dogs. Canine hip dysplasia is a complex developmental genetic disease of the coxofemoral or the hip joints of rapidly growing large breeds of dogs, characterized by varying degree of laxity, resulting in subluxation of the femoral head, shallow acetabulum, and flattening of the femoral head. This disease often results in secondary osteoarthritis of the hip joint. Radiological examination of coxofemoral joint is often performed in various breeds of dogs to assess and determine the genetic carriers of hip dysplasia in order to remove them from breeding program. The Boable dog, which we performed a lot of work on, is a rapidly growing big Molosser type of dog, reported to be a crossbreed between Bull Mastiff and a South African breed called Bulembita, AJADI and Doyin Dada 2019. Boable is probably one of the most bred dogs in Nigeria because of its size. In order to determine the prevalence of hip dysplasia in Boable dogs, AJADI et al. In 2023 reviewed the ventrodorsal and the flexed lateral radiographs of dogs presented for hip and elbow certification between 2016 and 2020. The result revealed that 57.8% of the Boable dogs have hip dysplasia. And hip dysplasia grade 3 or grade C accounted for most of the cases of hip dysplasia in this breed. This should be taken into account when planning breeding in Boable dogs. Animal welfare. The welfare of animals includes its physical and mental state. A good animal welfare implies both fitness and sense of well-being. Any animal kept by humans must at least be protected from these 5 unnecessary suffering. Freedom from hunger and thirst, freedom from discomfort, freedom to express normal behavior, freedom from fear and distress, and freedom from pain, injury, or disease. Our work on transportation stress. Road transportation stress is the acquired stress condition of animals during transportation, in which the rules and the regulations that governs normal transportation welfare of the animal is not adhered. Most of the changes that occur in the body parameters of transported animals are as a result of poor handling, loading, and confinement of animals during transportation. This is further compounded by the non-provision of food and water during transportation. In order to determine the effect of transportation on the physiological status of cattle slaughtered in Abeokuta, AJADI et al. In 2012 obtained blood samples from 62 cattle immediately after unloading them at the Lyridge in Lafenwa, and we compared the result with another 62 cattle that returned from grazing in our university. The result of this study revealed that the plasma glucose concentration and plasma cortisol concentration was significantly higher in road transported cattle compared to those that are freely grazing. In addition, the result showed that road transportation of cattle without adequate consideration of welfare is stressful, with the attendant physiological responses such as elevated plasma concentration of cortisol and blood glucose, and a tendency towards decreased immunity if the journey is prolonged further. No wonder why when we transport some animals from one place to another, you see them very tired. In some cases, you even lose some on the journey. The Vice Chancellor, sir, the welfare of an animal is dependent on the welfare of the parent or the carer. On the basis of this, AJADI, in conjunction with others, studied the prevalence of workplace welfare-related syndrome called burnout among veterinary professionals in Nigeria. What is burnout? Burnout is a chronic workplace stress syndrome characterized by emotional exhaustion, depersonalization, and reduced personal accomplishment. Lee et al. 2024. The personal cost of burnout include feeling of lonesomeness with a tendency to commit suicide, anxiety, apathy, aggressive mood disorders, and frequent irritability, cardiovascular and respiratory symptoms, reduced resistance to infection, and neck and back pain. The consequences of burnout on the employing institution include decreased productivity, increased interpersonal conflict with peers, and a tendency to abandon job. Studies have shown that the number or the prevalence of burnout is increasing globally. Nail et al., 2022. AJADI, in conjunction with others, carried out a study to determine the prevalence of burnout syndrome among veterinarians in Nigeria. Adebayo et al., 2009. Questionnaire comprising Copenhagen burnout inventory instrument, demographic, occupational data, and health records were administered to veterinarians. The study revealed that 20% of veterinarians in Nigeria reported high levels of burnout, characterized by lower job satisfaction, higher emotional and physical exhaustion, anxiety, irritability, and pains. The Vice Chancellor, sir, this study was carried out in 2009, when the socio-economic indices of Nigeria was much better compared to now, when the inflation rate, the cost of living, available social amenities have worsened till now. The current workplace reality might also have been compounded by the increased rate of migration of skilled laborers, the Jackpot syndrome, as well as embargo and employment and the poor salary remuneration in comparison with the cost of living. One can only imagine what the current prevalence of burnout syndrome will be in different work environments in Nigeria and the university system in particular. The implication of this is a higher prevalence of Nigerians suffering from emotional and physical exhaustion, anxiety, irritability, and pains. My contributions to human development. The Vice Chancellor, I've been involved in both undergraduate and postgraduate training since assumption of duty. I've also served as external examiner to the Faculty of Veterinary Medicine, University of Nigeria, Nsukka, and the Department of Veterinary Surgery and Radiology, University of Ibadan. 3 of my students have recently passed the Royal College of Veterinary Surgeons MRS-CVS exams and have been licensed to practice veterinary medicine in the United Kingdom. In addition, 2 of my students have recently passed the North Atlantic Veterinary Licensing Examination and are licensed to practice veterinary medicine in North America. Postgraduate supervision. Mr. Vice Chancellor, I've been involved in postgraduate training in the last 13 years, during which I've jointly supervised 17 postgraduate students across 3 departments in the university. As of today, I've supervised 7 doctoral candidates, as well as 11 MDSc, MSc students. In addition to this, I've served as external examiner to Ahmadu Bello University Zaria and University of Ibadan at different times to assess thesis of doctoral candidates and the dissertations of master's students. Curricular development. The Vice Chancellor, the development of academic curriculum is the foundation upon which a sound academic program is built. In this regard, I designed a new course titled Principle of Animal Pain Management to the CC Mass curriculum. In addition, the curriculum for a new undergraduate program in veterinary radiography aimed at training the required manpower in this area have been submitted to the College of Veterinary Medicine and is currently undergoing necessary review process. Once approved, this program will be the first of its kind in the whole of sub-Saharan Africa and is hoped to train the necessary manpower required in this area. Professional manpower development. Availability of affordable and high-quality locally authored textbooks is one of the major challenges facing the veterinary profession. In 2020, I was invited by the Tertiary Education Trust Fund, along with other selected veterinary surgeons in Nigeria, to produce a textbook for the teaching of veterinary surgery. the Vice Chancellor, I contributed 2 chapters to this book on wound healing and wound management. In 2022, I was admitted as a member of the Global Pain Council of the World Small Animal Veterinary Association, a body that provides advisory role on all issues of pain and pain management in dogs, cats, and exotic species. In 2023, the Global Pain Council launched an online pain management certification program for veterinarians, veterinary nurses, and technicians. And the goal is to provide global access to training in pain management. The Vice Chancellor, I contributed a section titled Misconception in Pain Management to the Module 2 of the Pain Certification Program. In addition, I've also provided lectures in pain management in trauma patients in Wasava and Savan conferences and contributed academic materials towards Wasava Pain Awareness Month. Development of dog breeds in Nigeria. Since 2016, I've been working with a number of dog breeds in Nigeria, including the Boabul Alliance, the Boabul Dog Breeders Association of Nigeria, the German Shepherd Dog Breeders Association, and the Canine Owners and Breeders Association, COBA. The focus of this collaboration is to improve the qualities of dogs meant for breeding through radiographic screening. This collaboration has resulted in the official recognition of COBA as an affiliate of the Federation Cynology International, FCI, a body that keeps the record of purebred dogs in the whole world. In addition, I've also received the World Union of German Shepherd Dogs certification as a elbow dysplasia, hip dysplasia radiologist and can submit radiographs of dogs for German Shepherd, hip dysplasia, and elbow dysplasia screening program in Germany. Conclusion. Although animals might not be able to verbalize pain, the changes in behavior and the physiological indicators are signs that are telling us that these animals, they are in pain. Several pharmacological options have been evaluated for their safety and efficacy in the control of perioperative pain in different species of animals. This includes ketamine, tramadol, midazolam, and gabapentin. We have also worked on snemucin as an osteoarthritis disease-modifying agent through its regulation of interleukin-6 and matrix metalloproteinase 3. However, further rigorous validation to determine its safety, efficacy, and route of administration is still required. Stress and pain are interconnected. Pain is a stressor that causes the activation of the autonomous nervous system. Thus, controlling stress and anxiety is an important aspect of pain control in animals. Finally, our study on the prevalence of burnout among veterinarians revealed important attributes of workplace stress, such as physical exhaustion, emotional exhaustion, and frustrations at work. Recommendations. Considering the lack of funding on research activities around animal sentience and animal welfare, I'm recommending that government, through the Ministry of Livestock Development, should provide a dedicated fund for researches on animal sentience and animal welfare. There should be introduction of topics or subjects on animal sentience or animal welfare in the educational curriculum, beginning from the primary school. In addition, there should be periodic training and certification for every researcher employing animals in their studies. They should be incorporated into the activities of our institutional research and ethics committee. The National Assembly should promulgate the National Animal Welfare Act to incorporate every aspect of engagement with animal use, including responsible animal ownership, animal transportation, animal trade, animal slaughtering, just to mention a few. Government, in conjunction with necessary regulatory agencies like NAFDAC, NDLEA, should remove the current restrictions to essential veterinary drugs such as analgesic agents. Government should also provide subsidy for animal medicaments as it is being done for humans. Finally, government should, as a matter of urgency, improve the socio-economic indices of the country by providing urgent intervention to improve the welfare of the populace. The Vice Chancellor, sir, the performance of any individual is tied to its welfare at work. In the light of this, I want to plead with the federal government to settle all the obligations they have with the staff of the university, such as the release of withheld salaries, payment of all outstanding allowances, and introduction of improved salary package acknowledgement. My profound gratitude goes to the Almighty God, the creator of all good things and the Father of light. He is the one who has been with me through this journey into animal sentience. All glory and adoration to the Lord. I'm immensely grateful to the management of the university, under the leadership of the Professor Olushola Babatunde Bankode, who gave me the privilege to deliver today's inaugural lecture. Sincere appreciation to all the past Vice Chancellor for providing the enabling environment to thrive. I'm grateful to the contributions of the Deputy Vice Chancellor, Academics Professor O.D. Akinyemi, and the Deputy Vice Chancellor Development, Professor O.U. Dairo. I'm indeed grateful to the Registrar, Dr. T.A. Adeniyi, the Bursar, Dr. Mr. M.O.O. Oshinoga, and the University Librarian, Professor K.A. Owolabi. Deep gratitude to members of the Publication Committee, headed by Professor Eileen Aduke Bodunde, for our useful suggestions and contributions to the manuscript. Profound appreciation to members of the Ceremonial Committee for organizing this lecture, the public relations, as well as FUMNAB Radio for publicizing it. My sincere appreciation to the past deans of the College of Veterinary Medicine, beginning from the founding dean, Professor Ebenezer Babatunde Oteshile, Professor Morenike Dikwaolu, late Professor Samuel Omotainse, and Professor Adebayo Akinloye. My gratitude goes to the current dean and my brother, Professor Lawrence Olushola Ajayi, and the Director of Veterinary Teaching Hospital, Professor Olugbenga Kehinde, for their support. I would like to extend my appreciation to the entire staff and students of the College of Veterinary Medicine for creating a good environment for me to thrive. Sincere appreciation to all heads of departments, academics and non-teaching staff. My sincere gratitude to all staff of the Department of Veterinary Surgery and Seriogenology for supporting me in the growth of the department. I'm grateful to my father, Alhaji Oshodi Ajadi, for the discipline and training he provided for us. My deepest gratitude to my late mother, Madam Adelayo Fajimi, for all of our struggles and labor towards my education and those of my siblings. In the honor of my late mother, my siblings and I voted a sum of 1 million naira to be endowed as a prize in the Department of Veterinary Surgery and Seriogenology. This money should be used for 2 prizes: the best students in veterinary surgery and the best students in the Department of Veterinary Surgery and Seriogenology. I'm also grateful to my second mother, Alaja Oshenike Ajadi. Your love and support have been overwhelming. I'm grateful to late Dr. Zain Alade Shawe of Ajaka Owo and Alaja Muniat Alade Shawe, Mommy, for giving me your only daughter as the best gift of my life. Sincere appreciations to my aunties, Alaja Muina Malik and her husband, Professor Malik, Mrs. Titelayo Omotosho and her husband, Professor Samson Omotosho, for their support. To my uncles represented by Alhaji Babatunde Ajadi, I want to say a big thank you. Late Professor Botsende Lagundoye, the first professor of radiology, University of Ibadan, inspired the resolve in me to be a radiologist. I'm grateful to him and his wife, Alaja Adejoke Lagundoye. To all my siblings that are here, Mr. Olaide Ajadi, Mr. Adeshina Ajadi, Mr. Abiodun Ajadi, Dr. Afolabi Ajadi, Mrs. Adenike Ambali, Mr. Adekunle Adebayo and their families, I am grateful. To the siblings of my wife, Mr. Rotimi Alade Shawe, Dr. Akiwumi Alade Shawe, Barrister Yemi Alade Shawe, and Dr. Kunle Alade Shawe, I'm very grateful. Special mention of the firstborn of my family, Engineer AJADI, for providing leadership and for supporting all of us to grow and thrive. Engineer AJADI provided the sum of 1 million naira that we are instituting. My deepest appreciation to the following people who have contributed significantly to my academic journey. Professor Adetunji Adeniro is my supervisor at the master's level in the University of Ibadan. He laid the foundation I have in the field of anesthesia and analgesia. Professor Ebenezer Babatunde Oteshile supervised my PhD work in spite of the fact that he is not a veterinary surgeon. Thank you, sir, for agreeing to supervise my PhD study, because without him, probably I might not have had a PhD in surgery today. I'm also grateful to my second supervisor, Professor Olajide Babatunde Kasali, my second supervisor, who has been a pillar of support. I'm grateful to my third supervisor, Professor Elin Oyebukola Notic, a former director of veterinary teaching hospital in our university. Thank you, ma, because you have been a mother to me since our path crossed in UI. I'm grateful to Professor Robert Kabaga, formerly of the University of Pretoria, for giving me the opportunity to be trained in veterinary radiology. I'm also grateful to Dr. Susan Borovka for improving on my knowledge in veterinary radiography. Professor Olusuji Smith is the first person that I collaborated with when I transferred my employment from University of Ibadan to this university. He provided the enabling environment for all the PIGS works that I've mentioned here today when he was the director of the defunct PIMTech. Professor Adedayo Aribi of Morgan State University is my first biochemistry lecturer. She opened the door of her apartment to me and made sure that I never lacked anything throughout my university days. I'm also grateful. My sincere appreciation to Dr. Adekunle Abiade and Dr. Tunji Nasir of Petcare Animal Hospital and Truthmas Animal Hospital, because I started my career with them. Special thanks to the following organization: International Veterinary Radiology Association, the Faculty of Veterinary Science, University of Pretoria, South Africa, for awarding me the first Visiting Scientist Fellowship to the Department of Companion Animal Medicine, where I learned a little bit of radiology. The Small Animal Veterinary Association Nigeria provided me with a platform to thrive professionally. I'm grateful to Global Pain Council of the World Small Animal Veterinary Association. I'm grateful to COBA, to Boabul Alliance, to BDBAN, and to the GSDBA for their collaborations. My profound gratitude to the President and members of the Inawi Club 911 for their support always. The Vice Chancellor, I collaborated with the Inawi Club in their educational support programs to orphans. This collaboration has resulted in 2 of the beneficiaries graduating from our university with second-class degree. Special gratitude to all my students, both undergraduate and postgraduate, for allowing me to train them. Special thanks to all my friends, my classmates in primary school, secondary school, and universities. My neighbors, well-wishers for their support, and for coming to make this lecture a memorable day in my life, in spite of their very busy schedule. I'm immensely grateful to all my animal patients and their parents for volunteering themselves as a valuable contribution to my development. Without my animal patients and their parents, I could never have been what I am today. My profound gratitude to my children, Engineer Oluwaseun Taiwo Ajadi, Mr. Oluwaseyi Kehinde Ajadi, and Master Ayokunle Emmanuel Peace Aladeshawe Ajadi, for their love and understanding. Thank you for making us proud always. Finally, my sincere gratitude to my help of over 32 years, the manager of my resources, Professor Temitope Ajadi, for our love, support, and help all these years. Thank you for creating a peaceful environment that allow me and our children to thrive. Thank you for being a pillar of support and encouragement to me and our children. To God be all the glory. The Vice Chancellor, sir. Thank you, sir. The Vice Chancellor, sir. Please can you permit me to sing this song of appreciation to God? I'm acknowledging you for who you are, for all you've done in my life, oh Lord. I'm acknowledging you for who you are. Dansakire, Dansakire, Baba. I'm acknowledging you for who you are, for all you've done in my life. I'm acknowledging you for who you are. Dansakire, Dansakire, Baba.
Congratulations. Please, you can have your seat. You can have your seat. Wow. What a pleasant lecture. Thank you very much. Our 106th inaugural lecturer. Professor AJADI, the Federal University of Agriculture, Abeokuta, presents this award of honor to Professor ADETOLA RASHEED AJADI, Department of Veterinary Surgery and Stereogenology, College of Veterinary Medicine, as the 106th inaugural lecturer of the university, dated today, Wednesday, 29th October, 2025. Congratulations and thank you very much.
Congratulations.
Congratulations.
We also have this for you, sir. Congratulations. Thank you very much. Thank you.
Congratulations, Professor AJADI, from Professor and Mrs. Omotosho.
Proud of you.
Awesome, awesome, awesome. Awesome presentation.
That's right.
Congratulations, congratulations from Poland, Professor.
Please allow them. You see, one of their leaders, the former president of the Students' Union, Dr. Meshach Nwanko, was a student of Professor AJADI. He graduated from the College of Veterinary Medicine. So you can understand, this crowd was not rented. They are obliging him for all that they have done in their lives. Thank you very much. So we want to thank you very much, Professor AJADI, for that wonderful lecture. Distinguished ladies and gentlemen, we want to thank you so much for your listening attention. But before we go, while the lecture was on, I hope you caught one thing there. Professor AJADI thanked every member of the ceremonials committee for organizing a befitting, inaugural lecture. For those who don't know, the chairperson of the ceremonial committee, we want to thank you very much, Professor Temitokpe AJADI. Thank you for organizing a befitting lecture, both before now and during this occasion, and after this occasion. But congratulations for being the spouse to Professor ADETOLA RASHEED AJADI. We congratulate you. And I don't know whether it's Kehinde that's around or Taiwo. One of the sons is also around. We want to thank you, the children. We appreciate you. We congratulate you. For every member of the AJADI family, we want to say congratulations. And we will not go without also, as a university, appreciating our Oga, our mentor, Professor Ebenezer Oteshile. Prof, you are welcome, sir. Pioneer Dean, College of Veterinary Medicine, Professor of Professors. Thank you so much for coming, sir. And Mommy, thank you also for coming, ma. We appreciate you. Thank you so very much. Seated beside him is a former Deputy Vice Chancellor Academic, and also one of our mentors too, Professor Mrs. Eromosele. C.O. Eromosele. Yes, ma'am. Should I finish it up? Okay, thank you very much. You are welcome, ma'am. Of course, we also want to appreciate and thank for being in attendance a mentor to Professor A.R. AJADI, Professor Morenike Dikpeolu, former Deputy Vice Chancellor Academic. Congratulations too to you. And of course, we want to thank the man seated beside you for allowing you to mentor Professor AJADI, the one we popularly called the former Dean, College of Agricultural Management and Rural Development, Professor Wale Dikpeolu. Thank you so much, sir. We want to welcome also, I hope Mommy is in our midst, a former director of the Veterinary Teaching Hospital of this university, Professor Mrs. Helen Nottage. Oh, Mommy, you are welcome. That's Professor Nottage. Many people have heard of you, but they are seeing you for the first time. That's Professor Nottage, a former professor in the College of Veterinary Medicine and former director of Veterinary Teaching Hospital of our university. Thank you very much, ma'am. We also have in our midst, we would like to just mention their names briefly, Professor Yemi Akinrimade, the Acting Provost, College of Veterinary Surgeons of Nigeria. You are welcome, sir, Prof. Thank you so very much for coming. Of course, Dr. Kunle Abiade of Pet Care Animal Hospital. You are welcome. Thank you very much. Dr. Adetunji Nasir, Truth Miles Animal Hospital in Lagos. And we appreciate also the head of Department Veterinary Surgery and Radiology at the University of Ibadan, Dr. Adenike Adetunji Akioye. You are welcome. HOD, you are welcome. Thank you very much for coming. We have a lot of Professor Ajadi's classmates and friends. We want to welcome you. His childhood friends, we welcome you. And before I take my seat, please, perhaps one of his patients or their parents are in your houses, extend our appreciation to them. Because you brought them to him for treatment. He's sending his appreciation. Please deliver it when you get home. It's very much likely that your patients or their parents are in their houses. Exactly. Distinguished guests, ladies and gentlemen, thank you so much for coming. It's been a worthwhile lecture. We appreciate you so much. God bless you.
Thank you very much, sir. Thank you. We appreciate you, sir. Will you all be seated, please? Just a quick announcement. All COVID staff, academic and non-teaching, including the students, should kindly go to the College of Veterinary Medicine for their refreshment. All deans and directors should kindly join the Vice Chancellor's procession as they file out through the central hall into the conference room A for their own refreshment. All other directors, FUNAB professors, including professors from other universities and special guests, should kindly go through the VIP exit by my left hand side and proceed to the conference room B for their reception. All other academic staff of the university should please file out through exit A by my right hand side for their own reception. All non-teaching staff should kindly go through the central hall after the procession and collect their food packs in front of the conference room B. All other students of FUNAB should move to the gallery for their entertainment. Thank you very much. May we all rise now for the FUNAB anthem, followed by the national pledge. Thank you. Let us now recite the national pledge together. I pledge to Nigeria, my country, to be faithful, loyal, and honest, to serve with all my strength, to defend our unity, and uphold our honor and glory. So help me God. Please let us wait for the procession on the high table to file at first, while all of us in the hall follow suit. Let me remind you once again for the announcement, all COVID staff, academic and non-teaching, including the students, should please go through the College of Veterinary Medicine for their refreshment. All deans and directors should kindly join the Vice Chancellor's procession as they file out through the central hall into the conference room A for their refreshment. All other directors, FUNAM professors, including professors from other universities, and special guests should kindly go through the VIP exit by my